Hey gang, it's Nathan here, TransMidwife. It is 6 a.m. and I am awake because I was lying in bed trying to fall asleep and I just had thoughts racing through my brain of all the videos I want to make for you and all the different things I've got to say. Firstly, I hit 100 subscribers. Oh my god, 5 days in? Are you kidding me? I was not expecting that. Thank you so much for all the subscribes, likes, comments. I've had some really lovely comments about how I'm helping people to understand and I'm giving them information about how to care for clients, and it's really changing their knowledge base, and it's just so inspiring, hence why I can't sleep, so thanks for that. Other news, I cut all my hair off. What do we think? I don't know. It's at the moment it's wet because I've just had a shower, but yeah, I like it. I got bored. I had the same haircut like 600 times and then I just got bored, so this is the new one. I'll give it a try. Thankfully my hair grows really fast, so if I don't like something, it's not a problem. I am ginger inside though, so this is more of my natural colour, so when it grows a bit I'm going to have to put some more ginger on it. Anyway, I'm really sticking up now, Jesus. So firstly I started with testosterone gel. So I saw my GIC, my gender identity clinic, in September 2018, and then I saw them again in early November 2018, and then I got my T letter. Is that right? Oh well, I don't know. I got my T letter anyway early February, and then I took it to my GP. So I took it to my GP, and these letters as well from the gender identity clinics are about 6 pages long. They've got a hell of a lot of information about you, and everything, and the GP doesn't need to know all of that, so they're like looking through their letter, like trying to find the bit that's relevant. Thankfully on the back it broke it down, so this was not my normal GP. I have an amazing GP. I'm not going to name her because that's not fair, but she has quite a few trans patients in the area, and she just knows what she's talking about, and she's really supportive, and she genders you properly, and it is lovely. But I'll talk about her more in a minute. This was not my normal doctor. This was any doctor I could get an appointment with because I wanted my testosterone straight away. So I take her the letter, and she was like, okay, great, yeah. She was really quite good at first, and she wrote the prescription for testosterone straight away. Was really understanding. And then part of the plan in my doctor's letter was I needed to have some contraception. This is because it is very dangerous to become pregnant while on testosterone. In terms of the pregnancy, like if you wanted to keep the pregnancy, it's not safe to still be on testosterone while you get pregnant. So my gender identity clinic, particularly if you're in a relationship with a man, which I am, they want to protect you against that. So the part of the plan was to talk about contraception with the doctor. So we did the testosterone bit, which she was great about, and then I mentioned the contraception, and she was like, sorry, what? And I said, if you look in the plan, it says we need to talk about contraception. And she was like, right. And she sort of paused for a minute, and then she went, why do you need contraception? And I said, I was a bit stumped. I was like, because I'm with a man, and I don't want to have another baby. It's that simple, really. And she said to me, she was laughing a bit as well. It was a bit embarrassing. She was kind of smirking at me, and she kind of said, well, but this is the thing, you're telling me that you're a man and yet you want contraception. And she left it there. That was a question. That was a question. And I'm like there trying to answer it. I'm like, well, I still have the anatomy of a female, so I still need contraception for a female. And I had no idea what was going through her brain. Either she thinks that trans people don't have sex with their genitalia, she just thinks we just don't, or she thinks that testosterone makes me instantly infertile. Both are very misinformed, yeah. So that was awkward. Anyway, she wrote me the letters and she was fine, but it was a weird interaction, and yeah. Please feel free to leave comments below about any kind of similar experiences that you've had. Anyway, I took my prescription and I rang round all the pharmacies asking if they had the thing in stock, and I found someone who had it in stock that late afternoon. I went, I got it. I'm going to show you, I'm going to put a picture up of me when I first got my hands on the testosterone gel. Yeah, I was very excited. And I thought to myself, okay, so I'm gonna totally wait till the morning. I'm gonna put it on in the morning, because that'd be a good time to put it on. Incidentally, you can put testosterone gel on any time of the day that suits you, and you just try and do it reasonably around the same time each day. I was like, yeah, so I'll try and wait till the morning. As soon as I got my hands on it, I put it straight on. I just slapped it straight on, doesn't matter. It's about 7 in the evening. I was like, it's going on. And so yeah, for 3 months I was on the testosterone gel. So you don't have to deal with needles, but it is a bit of a pain. You have to put it on every night, or day, or whatever. You have to put it on every day. It's sticky. And so you have to rub it into your bare skin, and then it dries, and it's like an alcohol-based gel, so that it dries quickly. It can leave a bit of a residue. Some gels do, some gels don't so much, but I did find it to be a little bit sticky. A lot of people say to shower before you put it on, but I actually found that it sunk into my skin less for some reason, so I preferred to put it on not after a shower. Anyway, yeah, so my testosterone dose felt quite low to me compared to what other people have been prescribed, so I was a bit huffy about that. I'm not going to say what my dosages were because I don't think that's right, but I had to slowly increase from a very low dose, and I was a bit huffy about that, and I won't lie to you, because why would I lie to you? You're not going to judge me. I might have increased the dose a little bit quicker than I was supposed to. I do not advise this. Listen to your doctors. They know what they're doing and they do it every day. The gender doctors, that is, not the GPs. They do it every day. They know what they're talking about. And my doctor was absolutely right, pretty much on his regime, even though I thought that my final dose, you know, the highest one that he'd prescribed, was still really low. Actually, when I had my bloods done, my levels were perfect, and I did have plenty of changes in the first 3 months. So yeah, and then I have just moved to Nebido. So I was doing my gel. I went through 2 bottles in about 2.5 months, something like that, and by the time I got the 3rd one, I'd also got my hands on the Nebido. It's the 3 monthly injection. It's the one in oil. I wanted injections because I find doing something every day quite tedious, and also there is a danger of transfer from your skin. It's pretty minimal, especially with good hand washing and everything, but I do have small children, so it worried me, and I just wanted to get on the injections. I just think it's more convenient. There's definitely no difference compared to gel or injections. Some people, because you think you're being stabbed, the changes are going to happen more quickly. It's not true. It's just about how your body metabolizes different drugs and how your levels are in the blood. So as long as your levels are good, your changes will happen, and that's how it is. And some people can't get good levels with one or the other, and it's just about different people and how they respond to different medications, basically. So yeah, I went to my gender identity clinic and I requested to change to Nebido, and my first lot of bloods were perfect. Like I said, my testosterone level was exactly what they wanted it to be. My gender doctor, so he was really happy with my testosterone levels, but he did say that my estrogen levels weren't being suppressed at all, so they were just as high as they always had been. So he wanted me on blockers as well. For me, I didn't have a loading dose of Nebido. I'm not sure how normal that is or not. It's just what he prescribed. I took it to my normal GP now, and she was brilliant, and she prescribed the Nebido and she prescribed me the blockers. With the blockers, I have to have 3 smaller jabs once a month for 3 months, and then I get to move to the 3 monthly bigger one. So eventually the injections will sync up and be on the same day, and I'll just have 2 injections, 1 on each side, every 3 months, and that'll be it. What else? Yeah, just about getting my first injection. So I put the gel on for 3 months in the same place, and then I suddenly had a skin reaction to it. I'm not sure why this is, but I am prone to skin reactions. I've got sensitive skin, I get a bit of dermatitis or whatever, and it's basically what happened. My skin erupted and all these itchy bumps, and it was horrible. And it was where I put it, so then I moved it, putting it to a different place, and it just happened immediately everywhere, and my skin was like really inflamed and it was awful. So I had to stop the gel cold turkey, which... and I stopped the gel, dealing with the itching. I put it on as much as I could until I could get someone to inject me. I tried to go to a walk-in GP surgery to get them to inject me on a Sunday because I was erupting in this itchy rash and I didn't want to go a day without any testosterone. And I asked 2 GPs and neither would inject me because there was no nurse available who normally does the injections. I'm like, do you not know how to do an IM injection, mate? So that was really annoying, but thankfully my gorgeous colleague at work stabbed my ass, so it was all fine. Yeah, so about the Nebido injection. Fucking hurt. Not so much when it was being put in. It was all right. So it has to be done ideally over a 2-minute period, and so literally it's like in oil. So it's hard to draw up. So it's just drawing it out like that, just drawing it out the bottle, and then it's like a decent amount. I think it's 4 mils, and it's in oil, and it has to be injected into the glute muscle, which is your buttock, because there's so much solution, and that's the biggest muscle you can inject into. So my blockers can go in my thigh, no problem, because it's a small amount of liquid, but the Nebido has to go in your buttock. So I lay on a bed, relaxed, was comfortable. It was a colleague, so that was really nice. I was really relaxed, and yeah, she did it over the 2 minutes. It wasn't too bad going in, quite stingy, and my leg went quite numb. Just staying so still, I think, for so long, and the feeling, as it does push on your muscle, which probably pushes on nerves and things like that. So all the way down my leg went quite numb. But as soon as she took the needle out, it stopped. It went away. And then it was mildly sore that day, and then towards the evening, really sore. Like if I sat in a certain way, I had to jump up because it was so painful. That lasted a few days, and then that faded into more of a itchy lump, like a big mosquito bite or something. And then finally that settled down, I'd say about a week. I'm still itching a bit though, like 2 weeks later in the same place, but I'm itchy, I'm a weirdo, I have itchy weird skin, so I really need to like not do that. I'm gonna stop talking now. Yeah, that's been my testosterone journey so far. Thanks for listening.